Well, can you stand on one leg for more than 10 seconds? Do you think that President Biden could, or perhaps even Speaker Nancy Pelosi? Well, that is a question that many Americans are asking themselves after a new study came out in the British Journal of Sports Medicine, which found participants between the age of 51 and 75 who could not pass the 10-second balance test were nearly twice as likely to die in the next 10 years. It's hard to hear that and not try that for yourself. Well, here to break down the new findings is orthopedic sports medicine surgeon at Mount Sinai Hospital, Dr. Robert Parisian, who is also a team physician for Team USA's ski and snowboard and fencing team. Dr. Parisian, it's good to see you. Welcome to the show. All right, a lot of people trying to stand on one leg to see if they are going to survive in the longevity of life. I mean, how realistic is this balance test? Can someone actually determine their life expectancy for a 10-second balance test?
Well, it's a pleasure to be with you here on this beautiful Independence weekend. This study is very interesting out of the British Journal of Sports Medicine, as you just stated, because they really try to get at a surrogate for mortality through something that is really reproducible that you can potentially do in the office with basically this 10-second balance test. And really what this is this is looking at your sort of risk of fall and then trying to get a sense of that. So we do know that elderly patients, as you age, they have an increased risk of fall. And when they also have increased or decreased bone mineral density, for example, so their bone's a little more frail. And so when they fall, they're more likely to fracture. And then that fracture can then result into increased morbidity and mortality. And so basically this study really sort of just connected the dots between your ability to balance for a 10-second single-legged stance and then your risk of mortality. But I would caution that you don't have an increased risk of having other health concerns. Rather, those that who are unable to perform the test, they actually came into the test having a less healthier profile.
Okay, so how important is balance? Because as you mentioned, falling is a leading cause of injury-related deaths for anyone over the age of 65. Is it too late to start improving balance once you're in that age range?
No, balance is extraordinarily important because what we don't realize is that, we're doing things on a single leg all throughout the day. So walking, jogging, going up and down stairs, these are all single leg activities. So balance is very important. When we get at the root cause of balance, it could be any number of things. So if you're standing on one leg, what are you doing? Well, you're picking one central point. So if you have any issues with your vision, or if you have any issues with your inner ear, we call them vestibular issues, these could affect your balance negatively. Going down the line, I'm an orthopedic sports medicine surgeon, so I think about the musculoskeletal system, and that's weakness. That's muscle asymmetry, really with your lumbar musculature, your core, your dynamic hip stabilizers. And so these things that may be issues could contribute to you having a decreased balance and an increased risk of fall.
So what are basic things that people can do to improve their balance right now if they're watching at home?
So what they can do is that they can get to the root cause of this. Then they can go and they can consult with their primary care physician, who can then help organize what that is. If that happens to be a weakness or an asymmetry in your balance, then really doing strength training activities, because once that tendon is pulling, that muscle is pulling on that tendon's pulling on bone, it's going to remodel that bone and it's going to strengthen that bone. They can walk, jog, and do some of those activities. Also work with a physical therapist, work with a strength and conditioning a trainer, or coach, or specialist that can help strengthen those muscles that might be leading to that weakness and that asymmetry, leading to your increased risk of falls. And if you have, and you're getting elderly, you might want to have your primary care doctor look at your calcium levels, your vitamin D levels. These can all be improved upon to help increase your bone mineral density and the strength of your bone.
Do you feel like this test is something that doctors should start adding to the routine checkups?
Well, I think it's interesting because from a sports medicine perspective, we already do some of this. We have things called Get Up and Go, where we see if patients can get up from a seated position, for example, without using any assistive devices. When I return athletes to sport after an ACL injury, for example, we do single leg hop tests and batteries to see if they have the same symmetry. So yeah, I think that this is something that in the primary care setting certainly can be reproducible, and it's easy enough to do. It's just a 10-second single-legged stance, and you have 3 attempts in the office, and this can be something that can at least get the ball rolling as to investigate why you may be having some of those balance issues.
Yeah, I know a lot of people have been doing it. We've been doing it around the office, checking each other out. Dr. Parisian, thanks for being here with us on the 4th. Happy 4th to you, and thanks for giving us your insights.
My pleasure. Happy 4th.